Hi, my name is Joy-Ferguson, and I'm going to present to you a literature review and a meta-research review of effective workplace health promotion implementation. The primary goal of this study is to comprehensively identify hindering factors that affect workplace health promotion and find optimal solutions for mediating the relationship between workplace health promotion and intervention effectiveness. Workplace health promotion began with three major phases during the quest to promote healthy individuals while transforming company office personnel from routine paper processing to modern-day human resource departments. The primary problem is that organizations are failing to properly implement health promotion comprehensively. Employers are not optimizing resources to prioritize health promotion. Some of the problems contributing derive from poor human resource management or the fact that small businesses struggle because of financial hardships. Another problem was that non-participation by employees was a result of desiring to keep private life separate from work. The goal of the study is to analyze health promotion intervention effectiveness within organizations and provide new strategies for firms to implement in their organizational management structure. Many organizations attempted implementation methods. However, the problem remains that there is a lack of understanding, which makes workplace health promotion efforts difficult to improve. The study is significant because the business community needs to develop a business-medical partnership. Studies have shown that there is a connection between strategic workplace health promotion, lower health risks, lower healthcare use, and improved productivity for employees. Assumptions for the study include that participants of surveys are telling the truth and that the working population is between the ages of 18 to 65. Another assumption is that small businesses are generally economically challenged. Limitations can be a possible selection bias due to low responses in surveys by employees who are not participating in health programs. Self-reported data presents a limitation that sometimes the participants with more education respond over individuals with less education, as well as older working adults tend to participate more than younger, which presents an age bias, as well as a possibility of mental health issues in self-reported data. Delimitations, the selected boundaries of the study, focus on the business perspective and is structured around an office environment for the average corporate employer. It specifies at least one physical location with hired employees and does not include self-employed individuals working from home. This also focuses on businesses that are not considered primary medical facilities. The purpose of a literature review is to examine the various elements of workplace health promotion development with supporting research information and evaluate the ultimate solution for improving health promotion effectiveness. In the 1970s, the release of the Londe Report proposed the concept of the health field and was the first modern government document in the Western world to emphasize the problems in the biomedical healthcare system. It was so effective that it initiated the development and evolution of health promotion. Modern-day workplace health promotion has turned its attention to workplace determinants of health, such as individuals' genes, behavior, factors in economic, social conditions, and cultural variables that impact a person's mental and physical health. There are also tools available for businesses that have been created to address the health determinants in the workplace. Small businesses consider health programs an imprudent commitment of resources, while large employers have the ability to negotiate group health at their needs. The workplace presents an ideal avenue for the delivery of initiatives to promote physical activity because the benefits include helping employees reduce sick leave of absence, increasing staff retention rates, and increasing overall company productivity. Meta-research. In order to research the validity of this argument, I reviewed several scientific studies on the topic of workplace health promotion in a meta-research and analyzed results based on existing data. The first study was performed by Beck et al. 2015 and focused on evaluating the prevalence of health promotion implementation in workplaces and determining patterns as well as the factors that influence them. The second study was by Raj et al. 2016 and focused on evaluating the successful implementation of health promotion measures that influence the various phases of health promotion implementation. The last study was performed by Wells al-Ghuli, 2018, and focused on the importance of employers' efforts on workplace health promotion through the evaluation of cost analysis. Now, in the first study, the methods of data collection consisted of survey data collected from 6,500 companies with a questionnaire asking interviewees about sick leave data, staff surveys on workplace health, in-house exercise programs, health circles, addiction prevention programs, and individual health checks. The second study was a qualitative systematic literature review conducted to identify interfering factors with managerial implementation phases of health promotion using research evidence collected using electronic databases. Now, the third study was a work environment survey, which consisted of data about work capacity, work performance, work quality, and data lost due to working hours from illnesses. The first study, based on the data collected, I determined that there was a large gap between workplace health promotion activity depending on the size of the company, and that level A health promotion activity is extremely difficult for companies to come by even in a very good economic situation. In the second study, I was surprised that data from this study produced a category of motivation and accessibility of participants to be critical implementation barriers. This means that there is a high possibility that employees will not be participating in health promotion programs and that managers will struggle with employee participation. In the third study, I found the data collected showed a productivity loss of $683 per worker, in addition to $642 per worker lost as a result of illnesses within 1 year. This was a significant amount of revenue lost as a result of worker safety, and seems physical environment factors could also significantly contribute to employee health. In conclusion, I discovered that workplace health promotion has significantly improved over the last 40 years. However, despite efforts from employers, the problem remains that organizations continue to struggle to properly implement health promotion comprehensively in an effective and applicable manner. I believe organizations need to prioritize workplace health efforts and not overlook the financial consequences of employee well-being oversight. The costs for businesses to invest in workplace health programs are explained in the benefit-cost ratio, where discounted inflation-adjusted benefits are divided by costs. In order to implement effective health promotion programs, employees need to budget financial resources. Effective implementation requires businesses to place an emphasis on discounting or devaluing the future health benefits against the quantity of present investment. Now, the benefits of establishing effective workplace health promotion programs provide organizations with a return on investment that offers substantial benefits for company finances, productivity, and improving health outcomes. According to Ryan et al. 2018, researchers determined that program interventions improved total cost of medical claims by reducing expenditures from $350,000 to $150,000 in 1 year from a medical facility containing 1,400 workers. Lost time injury days were also reduced from 1,600 to 400 within the same year. These benefits significantly outweigh the costs, and employers should promote employee well-being while appreciating the economic impact and preventative strategies. Some final recommendations. Based on the literature review and meta-research studies, I was able to conclude that firms must develop new strategies for health implementation. They need to make health promotion a priority for high return on company investment. Firms should be aware that health promotion is necessary for a successful company, strengthening the organization's culture. A second recommendation is for employers to seriously evaluate their assessment and planning phases in order to establish a consistent, well-working plan. They need to place all emphasis on proper health promotion implementation. For starters, employers need to create a system of clear communication between supervisors and staff. Human resources need to access programs and create services for company employees. Managers need to consistently monitor their employees' mental stress placed on them daily. Small startup firms with limited financial availability can start by offering employees adequate sick leave, discounts on gym memberships, extensive information on health promotion and illness prevention. Larger firms should ensure the implementation of comprehensive health promotion activity by incorporating safety policies, programs, benefits, and other health and safety mechanisms designed to improve employee physical, psychological, and social status. All institutions should understand that health knowledge is the most important resource. In addition, partnerships with local medical facilities and utilizing CDC resources will significantly benefit organizations when incorporating employee wellness plans. Ultimately, companies should analyze their management systems at each phase of assessment, planning, implementation, and evaluation to determine how to prioritize health promotion while optimizing given resources, contesting interfering factors that limit the successful implementation of health programs. These are some of the references utilized in this presentation. This concludes my presentation. Thank you for your time.